So first of all, I just want to give a quick shout out to Health Arrows and Keith Wilson and others for the retweets today, and Canada Health Infoway and for the favorites and the new followers. So thank you for that. And then also, I want to say that my fundamental belief as CEO at HQO is that we will not have a continually improving system until the patient is fully embedded into the quality agenda. And I believe that the ability and the path to doing that, whether we want it or not, is going to be through digital health. And that's what I want to talk about. So I understand as a Crown agency, I've been in the job about 5 months and 2 days, that you always start with a quote from your minister, and that they send a senior person from the ministry, Dave Hallett in this case, to make sure it happens. So Dave, I've done it. And then I also understand in your first 6 months, they always send a board member to monitor your public speaking. So Dr. Alvarez, thank you for being here. Make sure I do okay. And so what the minister said quite recently was from a system that we need to move from a system that provides care for patients to a system that provides care with patients. And another way of thinking about that is we need to go from informing our patients to simply advising them to actually collaborating and ultimately empowering them. And I think that that journey is enabled through digital health. And so how is this going to make this happen? And I put a little asterisk there, and I did clear this with Dick at the break, that this is not just about EHRs and EMRs. I actually did a slide deck that was all about, OTN, Ontario Telemedicine, da, da, da. This actually is going to be about social media. It's going to be about apps. It's going to be a broader definition. I asked Dick close enough to the presentation while I was chatting to somebody else. He couldn't give me an honest no, so I expanded the definition. So this is kudos to Alberta. This is amazing. Downloadable app, real-time data about every emerge in Calgary and Edmonton, and what the wait times are. And if you don't want to go to that emerge, there's a whole list of interactive alternatives right on the side with links, with the times that they're open and closed, and you can download this onto your mobile phone. Like, this is incredible. I was seeing one of my homeless patients out on the street last week, just like 5 blocks from here. He was sick. He needed to go to the emerge. He, understandably for many reasons, was very reluctant to go to emerge. And he said, well, and we're in downtown. We're in the privileged richness of having numerous academic health science centers. He said, well, which one is going to be shortest? If I'd had an app like this, I actually could have told him. And if he'd had that information, I had a higher chance of getting him there. And in the end, I'm worried he didn't go. I hope he's okay. I'll find out next week, hopefully, if he drops by clinic or if I see him. So patients have a lot more access to the health system. They have access to real-time live data through things like this, like through wait times information, like this fantastic one that you get on your mobile phone. They also have a lot more access to their own information. And there are numerous, whether they're private sector or government funded, they have access to their own personal health information in ways they're no longer requiring USB sticks to be toted around. Great story that Sunnybrook, where I used to work, likes to tell of a patient who had a very, very complicated oncological surgery, thought she was in the clear about a year later, got on a plane, got very sick on the plane. She was going to an all-inclusive 5-day resort. There was literally no place to stop until they got to this very sort of remote sort of destination. She got off, very sick. The surgeons, there was a surgeon there. They had a good health facility. Said, I have no idea what exact procedure. She said, that's okay. I give you access to my chart, Sunnybrook Hospital. Surgeon went on, got the pathology, got diagnostic imaging, got the surgical report, figured out exactly what surgical procedures they'd done, everything. Went into that surgery with full confidence, had the latest blood work, the latest CT, all of the imaging, and went into that operation with the full knowledge of exactly where that patient was hundreds of miles away. So they have access to the system, they have access to their own data, and they have access to information about their health in ways that they've never had it before. And so this is a huge shout out to BC and the government there, and they have on plain language 24/7 on their website data available in a huge library about common, in fact, not just common, a huge database of health conditions, but all in sort of language accessible, health literacy appropriate information. Many of us, I hope many of us have watched Mike Evans' videos, 7 millions of brilliance, time and time again, communicating basic facts of healthcare in a way, in a medium that people are increasingly accessing. So better information about the system, better information about their own health, and communicate and knowledge about their healthcare in a way that's never been available before. Health Tap. How many people have heard about Health Tap? The American, of course, yes, our token American. Thank God we had a token American for this question, right? HealthTab has not been around for very long, for a very low price. In fact, I think it's almost free for the first couple questions. It's free. You can send in. They got a bunch of doctors there, and they will quickly, within a very, very short time span, respond to your questions. Now, if you want to get a whole consult and everything, I think there's a very nominal fee, but the first couple questions are free. And this hasn't been around very long. They've got 50,000 doctors already, and they've got over 1 billion interactions. So better information, better access to their healthcare provider, better access to their own information, and better ways of understanding it. And they know more about us as healthcare providers, right? Oh, I think you should go see Dr. Tepper. He's a great family doctor. Really? Let's see about that. Right? I'm glad you referred to me. I'm glad you golf with him. I don't golf, but glad you went to med school with him, right? Let's see what everybody else thinks who didn't just, hanging out in the same clubs, right? Well, on the bottom slide is actually a picture of a chiropractor who's about to do a manipulation. The fact is we send somebody in, there is very few medical procedures done or healthcare procedures done that you can't go on YouTube and find a couple hundred of. So somebody says, I want you to send you in, we're going to do a blah, blah, blah procedure. Really? Well, let's see what that's about. Before they even see you, they will have watched, if they wished, 5 or 6 or 7 or 20 or 40 videos of exactly the procedure that they've been referred to do. This was a whole nother level of awareness, and more they're going to have things like Rate MDs. We'll move like New York, where they post cardiovascular outcomes and death by individual cardiac surgeon on the front page of the New York Post, not Times, every year, and they've been doing it for 15 years. They interact every day with the hospital. This is a Twitter feed. This is a bunch of Twitter feeds. So I'm just going to read you one in the interest of time. But here we go. Somebody tweets out. I'm going to read you two, actually. Well, visiting hours are over. I'm still here. Shh, don't tell anyone. I'm here at D-Wing. Buddy, watch out, dude. Sunnybrook is pretty savvy on social. They tweeted at me when I was there. I didn't even at them. Oh man, they're great here. I never got a reply from, it doesn't matter who, from somebody, but they're all about here, right? So this great interaction. So here we go. Somebody tweets out, had a first terrible experience with doctor at Sunnybrook, refused in the end to allow him to treat my dad. We hear your frustration. Would you consider sharing your thoughts give a link? Your feedback helps us grow. Boom, Department of Patient Experience is just fabulous. I'm so impressed, I'm going to volunteer. Went on the side, they figured out where he was, that this individual was in the hospital, sent down one of our patient engagement volunteers, completely changed it. He says, they're gonna actually volunteer. Sunnybrook, that's so wonderful to hear. Glad they could help, glad you'll be helping too, right? Imagine, that is a level of interaction with the healthcare system that we could only have hoped for 10 years ago, because these people would have simply walked out and complained or had no prayer to complain. And so it's a really fundamentally different dynamic than we've ever had before. And that's big stuff. This is somebody getting so upset they refuse to let the care. The one on the other side, here, keeping my dad comfortable here at Sunnybrook. Sunnybrook, hey, great, let us know if we can help. Funny, actually, thank you. Maybe you can tell me how to get a parking badge. Sure. Go to this link, or call them here, or go to this room, right? Unbelievable, and if you look at the times, very rapid response in changing the patient experience. And access, again, to the patients, to their healthcare system in a way that is quite unprecedented. Alberta wait times reporting. So now not only do they have access, not only do they have information in different ways, in more accessible ways, their own information, they're now starting to actually get to make some choice. So again, back to Alberta, very easy user interface, knee surgery, figure out where the knee is, go, and you can start to say, what is the wait times? Now I'm starting to give myself some choice in my healthcare decision making. And now let's take it up one step further. Hold on, sorry. This is one out of order. And actually give them complete control. So e-referral is great, but what if we actually gave the power to make those referrals about where and when and to whom right to the patient? So this is out of the UK called Choose and Book. The GP says, I need you to go see a specialist, but I will either sit down with you here right now, or you can sit down with somebody else who's on my office, or we'll give you control of it and you can do it at home on your own time. And the fact is, it's a complete change in actually giving patients complete control over this pathway of care. I'll go back very quickly, I think, to just one slide. They also have community, right? It used to be the only people you knew with your disease are those that were on your street or you bumped into in the waiting room or somebody told somebody. Now we have patients like me that are actually crowdsourcing data equivalent to clinical trial level data in terms of the N and in terms of the quality of data that some would say that is huge. And so they've got a whole community around them that's allowing them to engage in their system and the discussions around quality and the care they're receiving. And finally, all things need leadership. And patients now have leadership. Dave, who I know Susan mentioned, follow him on Twitter. I actually think he's in BC today speaking at the Quality Council in BC, if I followed his Twitter feed right. Unbelievable following. Go to his TED Talks. It's actually dated now, but it's still very powerful. And Amy Gleason, if you have not seen the YouTube video of her daughter, I'm 15 years old and I need to be heard. It's a minute 40 of your life that is well spent. Huge leadership on the patient engagement movie. The end result is something Helen Bevan talks a lot about changing the healthcare system from one of a dominant approach to one of emergent direction. Power through hierarchy, through power through connection. Mission and vision through a shared purpose. Making sense through rational argument to emotional connection. Top down to viral, and it goes on. And a fundamental shift that's the end result of this type of patient engagement that we're seeing. One thing I don't think we do a great job talking about in healthcare is failure. And we will inevitably, on the journey to engage patients, have failures in our ability to roll out some of these systems, have failures in the ability to spread and scale, as I think Dick very appropriately challenges, have failures. And we have to not hide from those. We have to embrace those. We have to put them out there. We have to accept them as part of our journey and have a conversation in a constructive way that allows us to grow and learn and continue to drive the quality of healthcare. Thank you very much.